We are a nation of sun worshipers, and in the summer months, many of us do all we can to get that golden tan, despite the fact that we know that sun damage can lead to skin cancer. And it's not just the sunbathers who run the risk of skin cancer. It can happen from years of exposure in areas like the ears or nose, which are rarely if ever covered. There are 3.5 million cases of skin cancer diagnosed every year in this country. Dr. Katherine Sahm of St. Francis Hospital in Wilmington, Delaware says there are 3 major types of skin cancer, and some forms are more serious than others.
There's 3 main types. The first one is squamous cell carcinoma. There's also basal cell carcinoma. The most concerning is the third one, but luckily also the rarest. It's called malignant melanoma. The first 2 types of skin cancer tend not to spread anywhere in the body. They tend to just become a local issue, which can, if caught early, can very often be treated with very minimally invasive techniques, sometimes including just a cream. So we're basically looking for areas to get them under control before they become a problem. The squamous cell carcinomas can continue to grow locally to a larger size, so obviously you want to stop that before it occurs. And sometimes those do need to be removed surgically.
Dr. Sahm is well known for her surgical assessment and treatment of women with breast cancer. But as a general surgeon, she sees a wide variety of conditions, everything from gallbladder removal to colon cancer. But she notices that she is dealing with a growing number of people who are affected by skin cancer.
It's one of the fastest growing cancers. Dermatologists do handle a lot of the early cancers. The most serious cancer, the malignant melanoma, tends to fall more into the hands of surgeons.
When you have someone with a malignant melanoma, what type of surgery is it? Are there all sorts of things you have to do?
Well, it depends on the depth of the cancer at the time it's found. So the first part of the procedure is to actually biopsy the lesion and find out exactly how deep it goes into the skin. Depending on that, sometimes the lesion just needs to be excised, just basically cut out, enclosed. But if the lesion is deeper, or if it's been left to go longer, sometimes the lymph nodes need to be looked at as well.
Malignant melanoma, the most serious form of skin cancer, accounts for only 3% of skin cancer cases, but over 75% of deaths. When you talk to your patients, what do you tell them about ways to prevent getting skin cancer in the first place?
Well, the best way is to avoid excessive sun exposure. Unfortunately, a lot of the damage we all have is done at a very early age, in our childhood or when we're teenagers. However, that risk accumulates over time. So at any age, if you can start to take steps to decrease that risk, it's appropriate. The best way is to avoid sun exposure and use sunscreen.
Many people say you can only experience skin damage on days like this where it's bright, warm, and sunny, but damage can occur all year long. You have to be careful. I'm Dr. Brian McDonough.